welcome to the Week in Review for Module 4. Okay, we're done with drugs. We're done with that pharmacology unit. I know that was a little tough for some of you, but if you look at your aggregate scores, all of you are doing very, very well. So keep up with what you're doing, and you should do just fine in the course. Also, you probably noticed in the course news a little bit of a change. Last week I said we would do an extra credit because we're really under the gun here as far as time, and I know that you don't have that much time to complete additional assignments as far as extra credit. I thought at looking at the scores that we would just drop the lowest quiz grade. So we're going to do that versus the extra credit, so it will benefit everybody, and you won't have to worry about trying to squeeze in one additional assignment if you need it. I think that should help anyone who's on a kind of that marginal zone between two different grades is by dropping that lowest quiz grade. All right, so what are we doing for this week? Now, Module 4 is where we're going to be discussing legal and ethical issues as it relates to patient care and medical imaging. Another big difference that you'll notice is no textbook. Actually, no more textbook for the rest of the course. So you can, if you want, you can go ahead and eBay that pharmacology textbook, though it is a nice one to have handy. But you will not be revisiting that. This week, you will have some readings, though. They're textbook-like readings. We have 3 chapters from a textbook, which we are allowed to reproduce for you at no cost. So you'll be reading those 3 PDFs, basically, again, 3 chapters, very much like a textbook reading. So get into those relatively quickly. All of your quiz questions will be based out of that reading. One will be on informed consent, which is continuing to be a very hot topic in imaging as we're trying to figure out, I guess, best practices for informed consent within the medical imaging department. Documentation will be another chapter, which is very, very important in medical imaging. They're kind of your CYA, if you will. So you'll be doing documentation. And then the other reading will be on more specific imaging, medical imaging related legal and ethical issues. So you have a whole chapter reading in that. Chapters aren't very big, but if you like, you can always print out the PDFs or just read them on your laptop or put them in your favorite book viewer, and you can read them on an iPad or a tablet because they are in PDF format. As I look at my notes here, there is an additional reading that you'll want to, I will say, just be more aware of the content. You don't have to maybe read the entire thing. There will be 1 or 2 questions on the quiz about this, and just having a general familiarity with the content should help. But they are the standard of ethics, the standard of ethics from the ARRT, and the other one is the Code of Ethics by the ASRT. So please look at those 2 documents. Kind of become familiar with the essence of what's inside them. One is more aspirational, and the other one is much more, legal. You have to do, or you will lose. And those are the standards. The standards you have to do, or it's, you could lose your registry status. But the Code of Ethics are what we aspire to be. So please look at those 2 documents from the ARRT and the ASRT. So that'll kind of cover the readings for this week and presentations. Now, with the quiz will come out of all of those readings. So please, again, do read those. Okay, looking at my notes here again, the question of the week will be on informed consent. So again, the little mini chapter that you'll have in there, that PDF, will help with the question of the week. Learning activity. Now, learning activity, we're going to do something even different than what we've done before. You've done a lot of different things, everything from a simple Word document to these tests, these kind of have been open for 7 days. This one, a very important topic from the Image Gently folks, which some of our faculty are very involved with. And Image Gently, if you're not familiar with that, you will be over the next few learning activities. But that has to do primarily with pediatric dose. And we're going to start that off with kind of a general overview of pediatric dose and CT, which is, again, a very important area. Now, you may not be a CT tech or maybe not necessarily deal with children, but it is important to know that, especially if you end up managing a department someday, about the, again, it's, of course, the whole dose management is very important, but when you're talking about kids, it's much more important. So we're going to bring up our awareness on that. And Image Gently has some wonderful modules, and you'll be working through one of the modules this week. It's very easy to do. Just watch the module. At the end, you'll be able to print off a PDF, sort of a certificate of completion. Make sure that you just put your name in there, save the PDF to your desktop, to whatever name you want, and then you'll put that in the Dropbox like an assignment. So I know that you went all the way through that particular module. I think they run maybe 8 to maybe 12 minutes long to do that entire thing. So it's not too terribly long, but make sure you do that PDF at the end and submit that in the Dropbox. Okay, and then lastly, the final thing this week, again, kind of a busy week. The final assignment will be your unit paper. Remember, this course is divided into 3 units. We have drugs, this very, very small one on legal and ethical issues, and then the last one will be CT, MRI, more specific patient care issues in those modalities. So you have another unit paper to do this week. It's going to be a shorter unit paper. So the one that you turned in last week was 3 pages. This one only needs to be 2. And it will be more of a case study about who committed malpractice. So pull up that case study. It's in the module. And there's some questions that I'd like you to address in the narrative of your paper. And again, your paper only needs to be 2 pages, a title page, of course, 2 pages for the body. Use correct in-text citations, APA style, and then a reference page at the, of course, your last page will be a reference page. Again, 2 references will be required. That's pretty easy to do, to find 2 references on this topic. In the narrative of that body, the 2 pages, address the questions that are presented at the end of the case study, and you'll be fine. Actually, that should generate a lot of what you write by just answering those questions. But by no means does it have to be all centered on those particular questions. I expect you to add a little bit more to it as you kind of round out 2 pages on that who committed malpractice scenario. So that'll be that for this week, and kind of a little bit heavier week in light of having kind of this compressed into just one module this week. Remember, we're going to end the course with the CT and MR, and you'll have one final unit paper due at the end of that. So you have a total of 3 of these papers in all, but this one is only 2 pages. Don't do 3. Okay, excellent. Let me double check our notes here. I think we've covered all the topics that'll be in this week. Last week did a really good job. Everything looks like everybody's doing very, very well, especially on the points. I know that was a concern, so I looked at everybody's points. Again, when you run your calculations, toss one of the quiz grades out. So I think, if I'm not mistaken, that might bring our total for the course will be 930 points versus 1,000. So if you're doing your percentages, make sure you're doing it based on with the denominator being 70 points less. Again, I have to double check myself, but I think every quiz is worth 70 points. So you're when you're coming out to your percentage value, do not use 1,000, because I won't be using 1,000. I'll actually be using a lower number to see what your percentage value is at the end of the course. Excellent. All right. If any problems, any questions this week, this is a busy week, I know, please do not hesitate to contact me. Some of you are using the virtual office. That's great. Also, text message. So if you need to send me a text, usually you can get a reply back within a few minutes. It's when I receive it. So, excellent. All right. Well, as always, have a great week, and thank you for watching.